Hey everybody, Dr. Schultz with the Centeno-Schultz Clinic with another weekly update. It's hard to believe, but it's 2021, March, and this month we're taking a deep dive into low back pain. So today what I'd like to talk about is a disc protrusion or a bulge. So what we're going to learn during this brief video is what in the world is the disc in the low back? What in the world is a disc protrusion? Why should you even care what I'm talking about, and treatment options. So let's get started, and thanks for checking in today. So this is the lumbar spine. We all have one. This is the front, and this is the back, and this is the side. And so what you can immediately see is there are what appears to be some building blocks, sort of like the bricks in a building. These are the building blocks, and each one of them has a number. So what a disc is, it's basically a cushion between these building blocks, sort of like the mortar in a building. And we have one at each level, and it plays a really important role. What it does is it absorbs the shock of when we're jumping, or when we go off the cliff up in Vail, or when we're mountain biking, or we're trying to get that backhand on the court. So the disc is a very important structure that helps us do the crazy things that we want to do. So now what in the world is a disc protrusion? Again, this is a very important shock absorber. So let's look at the disc. So if you imagine that my hands are the disc on each, or the vertebral bodies on each side, a disc protrusion is something like this. So the disc is actually pushing out. Seen from the side, the disc is pushing out. That's what it is. It's simply the disc that is pushing out. And why in the world should you care? Well, let's take a look. Again, this is the disc, and the disc, and the disc. And here's an illustration of a disc protrusion, just like that. So it's a bulge, and why in the world should you care? See these little yellow things that are coming out? These are the nerves. So if you're on the slope in the back bowls, or if you're just down playing some volleyball and you get one of these that pushes on your nerve, ow! It's going to be a radiating pain down the leg, into the buttocks, and you may even actually cramp off the court. So why should you care? Because a disc protrusion may actually be touching a nerve and creating some leg pain, butt pain, knee pain, but it also is an indication that you have an injury to the disc itself, and it may be leaking chemicals, really inflammatory inflammatory chemicals. It's like a bomb goes off in your back, and you're like, oh my God, you sort of walk like the Tin Man. It's like, oh my gosh. So why should you care as that? And then treatment. The treatment is conservative therapy is always the first place to start, and that means some stretching, chiropractic, physical therapy, safe anti-inflammatories like fish oil or curcumin. When that doesn't work, some doctors actually recommend a steroid injection. And we really want you to know that steroids are actually toxic. That's right, they're toxic to the tissue, to the nerves that they're injected, and to the disc. And long term, they can actually make it worse. So what is an alternative? Here at the Centeno-Schultz Clinic, we have pioneered the use of PRP in and around the disc and disc injuries. That's right, we take your own blood, we process it, specialized just for you, and then we inject it around the disc protrusion and the nerve. And doing so, we can decrease that atomic bomb that's gone off in your back, and also decrease the inflammation along that nerve. So what's a disc? It's basically a shock absorber that allows you to be you. What's a disc protrusion? A disc protrusion is an outpouching that's abnormal, that can touch one of the exiting nerve roots, giving an unbelievable leg pain, but it also can just be a chemical solution that leaks out into your back, causing debilitating pain. That's why you should care. What are the treatment options? Avoid steroids because they're toxic. Hope this helped. Hope you now have a good understanding of what a disc protrusion is and what the best way is to treat it. Till next week, if you found this helpful, please share it, and we'll see you again next week. Be safe.